application, the way that I see it, the way that I do it. There's many ways to figure out how to, is this problem physical, mental, or spiritual? I'm going to sort through this with you and work to try to show you everything I can show you in a short amount of time. Put all these together. Who has a condition, ideally physical? As a chiropractor, the scope is more physical. Who has a physical condition that you don't mind sharing, and you don't mind it being on camera, and you don't mind it being recorded, that you would like to leave here either it gone from your life or on the way to being gone? I'm going to demonstrate how you could go about the process of doing that. Who has something you would like to fix or heal or be on the way to restoration? Any volunteers? Yes, ma'am.
Well, I think it's my hip that's out of place because my knee is hurting.
Okay. So we have a hip that's out of place probably because the knee is hurting. Okay. You want to come over? So I'm going to give you this remote, and I just want you to have a seat.
Sit here.
Microphone. Microphone, it's not a remote. Just have a seat.
Oh, okay.
Now, I'll ask you these questions. Now, all I'm doing is going through a history. I'm just going through a history to find out, is this thing a physical problem? Is it an emotional problem, or let's say a spiritual problem? Chiropractors treat physical problems. So I'll make sure, according to my scope, I treat it physically, because I'm not a psychiatrist or psychologist or a counselor, but I'll show you how it works. Where is the hip bothering you at?
Where?
Yeah, point to it. Okay, so left hip right there. And you think this pain is because your knee hurts?
Oh, the knee hurt because of this.
Okay.
Either way.
So where does the knee hurt?
Here.
Okay, which one came first?
Oh, I don't remember.
Okay. Which one bothers you the most?
This.
Okay. So can you recall about when, and all I'm doing is basic history. So when you felt the first pain?
Thursday.
Oh, so no pain up until Thursday.
Correct.
Okay, so we have Thursday. Now the next question is, did you fall on it, trip, slip, stumble?
No.
Okay. Did you do a bunch of up and down stairs, any type of repetitive stress or strain that could have wore it out?
No.
Okay. So now as a chiropractor, I'm like, uh-oh, how am I going to help her, because she didn't have trauma, but her knee hurts. So I'm making me think it's not a physical knee, it's not a physical problem. Now, have you taken since Thursday, before this hurt Thursday, any medicine, new medicine, eat any new foods?
Well, I'm detoxing from parasites.
Okay.
So this could be related to that.
So now so you started the detox. See, asking questions, and Dr. Fleet in his his Suggestive Therapy book says sometimes you interrogate the patient. I'm interrogating her. Why is this important? Because she's going to realize her own healing. Now that was a suggestion. I don't know if you caught it, but I already suggested she's going to originate her own healing. I just want to see how it works as a chiropractor. So she's detoxing because she found out she had a parasite. Both of those are part of the poison category. She's seeing a healthcare practitioner that's helping her cleanse. So this knee pain started after your...
Yes.
Okay. So you go, well, that's interesting. Why is it hurting now? And we could speculate. I'm not.
Because they don't want to get out of the body.
They don't want to get out of the body. They're like, well, how did we let this thing in the body? And why is it hurting us? So in this case, it could be done. Like, she has a parasite. It's a side effect of it cleansing out. And in a few days, minutes to days, it's going to be done. Her knee pain is going to be better. Her hip pain is going to be better. And she's going to be cleaned out. As a practitioner, doctor, should I take this steroid or not? I'm like, well, I'm not the medical doctor. Well, what do you want to do? Well, I want to take it, but I heard bad things. Well, why don't you just assume that the doctor knows what he's doing and you're going to be fine after you take it? Now when she takes it, she don't have to feel guilty for taking it. Or worried about, is it going to create whatever she read or whatever her friend told her. No, I'll take the thing. Now, if you're convicted and your doctor's convicted, he wouldn't recommend a certain treatment. So we're cleaning out. At this point, I can say, great, you're doing amazing. Let me check the knee, see if there's something physically wrong with the knee. Maybe a muscle's tight, the hips are out of alignment, and I can fix the hip out of alignment and the muscles tightness and align the knee and adjust the body in case this process is called muscles to be tight or too loose or dehydrated. So now I'm being a chiropractor. I don't have to worry about the parasite. That's being handled already by her other practitioner. I don't have to worry about detoxing. That's somebody else. So I could literally just be a chiropractor, check her body, check her hip, give her an adjustment, line her up if she's out of alignment, and make a great suggestion into her body that she is healing like this, and that parasite will be out like this. And then, nonetheless, by tonight, tomorrow morning, no more pain in the knee, no more pain in the hip, no more parasite. But we're going to check to see which system of her body is out, because I'm assuming it's her knee or her hip. Maybe it's not any of that. Maybe it's referred. So I'm going to use one of Dr. Fleet's method to check which zone of her body is out of alignment. I'm going to adjust the vertebrae connected with that zone, and then offer her healing suggestions so that the parasite go ahead and get out of there now, and then healing effects. So that's my role. I've maintained my scope of chiropractic. I found which zone. Now, could I take this in a spiritual way? Yes, I could go and find out other stuff, but I'm not, because I'm keeping this for logical and very, very specific. Okay, I need a paper towel or a head. So what I'm going to do is I'm going to have you lay down, and I'm going to show everybody what I'm going to do. This is one method that Dr. Fleet used to check which one of the 6 major health zones is out of alignment. We can make all kinds of assumptions. We could think it's the muscular zone, we could think it's the elimination zone, it could be a glandular zone, it could be a digestive zone, it could be a circulatory, it could be the nerve, we don't know. So let's find out. Now let me show you what we're going to do. I'm going to play a video just so you can see one way that you could check these zones. And hon, Jimmy, you ready for this?
Yeah. Wait, do I need to change the audio?
Yes. All right, so we're going to show how to palpate the zones on the back of the head. He's got a perfect head for this. So if we start right here in the middle, there's a bump right here that's called the EOP, the external occipital protuberance. Zone 6 is right to the side of here. Not on top of it, not below it, above it, but right there. So that's zone 6, circulation. Then zone 1, there's a little groove over here. Right under the ear, there's a groove right there, right there. You can see an indentation maybe. That's 1. So if you know that this is 6, so 6, that's 1. So we have 1, 2, 3, 4, 5, 6. We're right back to the side of the EOP. So that's on this side. We start here. 1, there's a little groove right there. 1, 2, 3, 4, 5, 6. Now I'm going to ask you. Surveyed the 6 systems, and whichever system had the most disease in it, and the one that had the most dysfunction, and the one you wanted to fix, we worked that system. It just gives us a place to start. So I'm going to find out what's going on, which system is out, so we can restore it. Okay? Okay. Lay on your tummy. Okay, so I'm going to press on these 6 spots. Each of you have a different style. You can use your own style. We're going to do something neat. She wants to do this work with her art. So there's a way to do this with art. But I'm going to press on 6 spots. Your job is to tell me which spot you feel out of the 6 that's the most different. However you want to whether it's tender, tight, painful. I'm going to press on 6. 6 of them. You tell me which one is the most noticeable. So here's 1, 2, 3, 4, 5, and 6.
3 and 4.
3 and 4. Now, 3 is the nervous system, 4 is the digestive system. We're going to isolate which one it is. The digestive system would involve the mouth, the jaw, the esophagus, the stomach, parts of the intestine. Anything that takes food, breaks it down for energy. There's a separate elimination system, but they can kind of share. The nervous system is things like the brain, the spinal cord, the periphery nerves. Emotionally, digestion could be you're chewing on something, you're grinding on something, you're processing something, you're not turning it over, you're not swallowing it. Or you swallow it and pick it back up, metaphorically. The nervous system is worry, fear, anxiety, high level of stress. So I want you to go back to just prior to your knee hurting. The knee started hurting when?
Thursday.
Thursday. So Thursday morning or Thursday afternoon?
Late afternoon.
Late afternoon. I'm asking questions now, back to playing doctor. I'm just asking. I'm interested. What happened Thursday? Could it be a parasite? Yes. Could it be something else? Yes. Could it be both? I'm interested now. I now, so go to the moment that you realized that your knee was hurting, knee and or hip. See if you can get very clear. It's afternoon on Thursday. Where were you at?
I was home. I finished doing my home thing because Thursday, that's when I do my house things. And I was feeling tired. I took a hot bath with Epsom salt. And that's when I realized that my knee was hurting.
Okay. Hot bath, Epsom salt, she realized. Okay. Now, I'm asking these questions because when she gets more present in the moment of the perception of her knee hurting, we have a better idea of what's going on in the mind. Did she think something? Did she hear something? Did she slip? Did her foot slip when she got out of the tub? Could be physical. I don't want to assume it's emotional, even though I like that stuff. I know there's always a thought before the thing. If she wasn't present, she could have slipped. She could have been thinking about something and then missed the towel, or missed the mat, or didn't use her reason to put something on the floor so that we don't slip. The list goes on. So go to that moment. You're in the tub on the Epsom salt bath. You there?
Yes, I'm there.
Okay, now I'm going to recheck her zones because I want to see, because her physiology will reflect her psychology at the moment that this all happened. So now I'm going to find out which zone is it now? Is it 3 or 4? Okay, so here's 1, 2. Okay, is it more 3 or is it more 4?
Can you do it again?
Yes, and because there's still some level of uncertainty, I want to go back to the bathtub. You see yourself in the tub, the Epsom salt, the heat. It feels good, you're relaxing. And when you got up, did the knee hurt? Or when you got out, the knee hurt?
I think it was a few hours after.
Okay, more data. Just getting clear on the history. I'm just asking questions. A few hours after, where were you, to the best of your recall, when you first perceived your knee was hurting?
Laying in the couch because I was exhausted.
Okay. You could hear how exhausted she was based on her words. She's giving a gesture of, Okay, now let's check. Now I have a better idea. 1, 2, okay, so here's 3, and there's 4.
4.
4. Her body's saying it's a digestive issue. Now, I'm just going to ask questions. Have you been having digestive problems?
Yes.
Yes. What specifically?
Well, I have gastroparesis, which is a delay of digestion due to many years of having diabetes, because I no longer have diabetes because I had a transplant 25 years ago. I had an enema in the morning because I'm cleansing myself.
Yes.
I wasn't hungry. I've been drinking all day. So,
Okay. And so we have a history of digestive issues. She's working through that. She's cleaning all that up. Now, let's talk mentally for a minute. You were exhausted. You were on the couch.
yeah.
Was this purely a physical exhaustion, or was there also some emotional or mental or exhaustion?
It was more physical.
Okay, so physical. Now I'm just going to ask her, so you worked hard all day and did a lot of cleaning?
Yes.
Okay, so she did a lot of cleaning. Now, zone 4, something was up with the digestion. She either didn't eat, body didn't get the energy it needed, but it did isolate to just one knee. So I'm interested in why the right knee. I don't know, maybe was there been any past issues with the right knee?
Yeah.
Okay. And did you have trauma?
Surgery. Yes.
Surgery. When?
Oh, many years ago.
Okay. So in this case, I'm still just seeking out. I could keep diving in. I'm not going to dive. I'm going to adjust her digestive zone. Which, because I will keep you here all night. Because I'm interested, very interested. Oh, she already did it. Erin already did it. My helper already helped me. So if you look at this, here is, and if you just bear with me there, and if you will just, I'm going to give you an idea. I want you to just, while I'm talking and explaining, I want you to picture perfect digestive health. I want you to have an image of what perfect digestion would look like. Perfect, the paresis, all of that stuff. I want you to image in your mind what you would love to see. Okay? You do that while I'm teaching. The digestive zone, we already talked about, these are some of the structures that the digestive zone handles. And everything can have physical, mental, and emotional components to it. When I adjust this vertebrae, C4, thoracic 4, thoracic 8, lumbar 4, it's going to allow the right signals from the brain to go down here to the stomach, and it's going to allow the stomach to talk to the brain. It's going to allow the brain to send the right signal down here to the intestines, and the intestines to send the right signal back up to the brain. Any of you in here that have digestive issues or digestive related issues, physically, or if you're mentally processing and chewing and grinding on an idea, this will allow, when we adjust this, stimulate this, this will allow that flow to go here and allow the organs to function properly. So I'm going to reset those for a second. Now, she's not an active patient of mine, so if it's okay, I'm just going to use a little tool that will help stimulate these sections. That way I don't know what's on the inside and how hard to adjust and whether she want to be adjusted or not anyway. So if I can just can I use that little clicker on you?
Absolutely.
And that will reset this digestive zone and allow the physical digestion to carry out, which will lead to the elimination of the parasite. It'll allow for mental processing, because she's probably still mentally processing and chewing on ideas. Could be even what she heard today. It'll allow that to take, and then I will recheck the zone and it will be better. She also had a zone 3, which is the nerve zone. The nerve zone goes to all the nerves. It's the brain, spinal cord, and outside nerves. So this will free up this zone and allow her to be calm, allow her autonomic system to regulate, and that's going to allow for better immune, better sleep, better digestion, because digestion's in there, better sensory function, more intuitive. You see all this suggestion. I'm sitting here giving suggestion after suggestion after suggestion. Now she's laying down and she can't see the picture, but I asked her to picture perfect. I gave her an image. I'm giving you an image because you're going to have enhanced digestive. I stayed within my scope. If you're into therapy and counseling, you would stay within your scope. You wouldn't do exactly what I'm going to do. You would do something different. But the principle is here. It's not the physical treatment, but because I have faith in this, and she has a problem, and she has faith in removing the problem. She clearly does, because she did an enema, she did a cleanse, she did an Epsom salt bath. So she's following through health-related suggestions, and she'll be a very fast fix. And she'll notice her digestive process is already improving. Her digestion is already doing what it needs to do. Even past stored old damage, this signal will allow restoration to her digestive tract. And as she continues to follow up with the right things, she'll continue to experience better and better. So, is the knee a tight muscle? Well, I can check. I can check to see what's weak and what's strong, and then we can check it after I do this. So let's just do a check. Turn over. This is, I could just go ahead and adjust her now and fix the digestion, but on your back. In the normal practice as a chiropractor, I would check certain things about the knee, because how else would you know what's wrong? Okay, you okay right there? Okay, bend this knee. You okay right there? Okay, I want you to push against my hand right here with your knee. Push against me. There you go. Now that's a very, very strong knee. Okay? Now, push up here with this one. Push up. That's a very, very strong lady. Okay, relax. Pull down. Pull down. Extremely strong. Her muscle doesn't give at all. I love that. Okay, let's check the other leg. Bend this knee. Hold there. Push. That one's not as strong. Push up. That's strong. Pull down. That's okay. Okay, relax. She's also had a hip problem. She mentioned the opposite hip. So when I adjust her, this leg will strengthen up, and that hip will strengthen up, and that'll be better. I can check that after. So that's a physical thing I could do as a chiropractor. She came to me for a knee problem and a hip problem. I wouldn't go in so much detail as I just did, because I would sit there, check this, check that, adjust it, therapy it, do my zone, and then give her a nice suggestion, say, you're fine, go. And if she had good faith in me and trust in me and it made sense, the suggestion would just work. All right, so onto your tummy. You're very strong, very healthy. She works out.
I'm 68.
68. I was going to ask her how old she is. 68. Very strong, very healthy, and yes, you are very strong. It's true, you don't offer suggestions that you don't have faith in, but I was throwing down suggestions, and she knew it and she accepted it. So sometimes people don't want to be physically adjusted, or they're in a way that you need an instrument of some sort. So I'm just going to stimulate this area. This area goes right here, all to the intestines. You okay?
It hurts.
You feel that right there. Okay. So now she's offering me another suggestion. She's now pointing out this really hurts. So because she gave me this, I'm going to address that. Otherwise, I was just going to move on. But there's no mistake that she said, okay, I didn't communicate, or I didn't give it enough attention. So what I'm doing is I'm pressing on this muscle, and this muscle will reset. This will feel a lot better when I'm done, okay? And could the hip be from a compensatory of the knee? Sure. Or could it be the hip? I could go from an emotional. I told you I didn't want to go, but I'm going to ask questions now because she's giving me more data. Your right hip represents, the right side represents a male stress. The hip could be a burden. So when you go back to Thursday, was there any stress or burden on you that led to the exhaustion that you felt after doing the housework? Because sometimes when I'm doing housework, I feel invigorated. I'm inspired. I got to listen to something I love to listen to. The floor looks good.
I already got it. Yeah, I know what it is.
Okay, so if you didn't hear that, I'm just talking. I'm asking questions. Now, if you don't feel the chill that just went through the room, I already got it. I already know what it is. I tried my hardest not to go there. I tried to keep this strictly just muscle, but she originated something new. So me listening, I went, oh, that's a message that says, I'm not on the thing. We're not quite in resin. I keep asking questions. If you hear me kind of fishing, I'm still fishing. I'm not certain yet. I don't have certainty. And so luckily, I get here and then the answer comes. She says, I already got it. Do you want to share or not?
Yes.
Okay, tell us what it is.
It's my oldest son. I haven't heard, I don't know anything from him for 5 years now. And I miss him. I know where he is because I found out where he is. So it's been on my mind. And his kids, my grandkids, they just moved back here to Dallas. So I guess that's where the problem starts, or the situation starts. So I've been thinking about that a lot.
Okay. So this is a perfect idea how her thought, she was having, I'm just going to call it negative thinking, negative frequencies that go into her body. Her body's fatigued from working. The body's not strong after working. It's weakening and weakening. It's shifted to the right side because that's the burden, the hip, the male. And then the left knee compensated. There was nothing wrong with the knee. I checked it. It was strong as it could be. If there was a problem in the knee, it would have budged. It was the other knee. But really the other knee, it was the hip. It's the thought behind the thing. Now we can have a field day. I'm still going to do the chiropractic thing because I'm not a counselor. But I'm really good at questions. I don't have their level of training. I don't need it. Now, if we could change her perspective, her perception of the event, shift it slightly positive, the body can equilibrate. And I could do it just with the stimulation here with the right suggestion. But I would like to do a little bit more because I already know I could do that. So, what's the thing that's the biggest burden to you about your son that you allowed this to be a negative more than a positive?
He doesn't have a relationship with his kids, which they are my grandson.
Okay. So, he doesn't have a relationship with the kids, which are her grandsons, because she assumes that if they had a relationship, that their life would be better. But the son knows. So this is this idea of this composite. This is this idea of this collective 2, 3, 4, 5 of us acting as one. You feel it come through because we're resonating, we're vibrating at a similar. Just because. And all of you really have an agreement because you have something of similar. There's something similar in your life or around your life that you're resonating with. Otherwise, you wouldn't pick up on it. You still good? We still good to go forward, or we need... Okay. What's the biggest advantage? The biggest advantage of your son not having a relationship to those kids. What's the advantage to the kids and advantage to you?
The biggest advantage?
The biggest benefit of them being not in a relationship with their father.
That they will not become like his father, but we don't know that.
Right.
Because I know my son comes from a trauma.
Okay.
Also, so.
Trauma. Now, just so you also know, she says the son comes from a trauma. We perceive that things are traumatic because we see more negative than positive. But if we understand universal law, we understand that there can't be more positive than negative and more negative than positive. If we use a theological construct and we say that God is all-powerful, all-knowing, everywhere, then it can't be good or bad. There has to be a cause for effect and effect for a cause. It has to serve in some way. We just don't see it. So all I'm trying to do now is give her a couple. I'm not going to go through the whole thing, but I want you to see that she perceived it one way. I'm trying to change the perception. What's another benefit to your grandchildren and to you that the father is not actively involved in playing a role in their life? Are you able to spiritually mend them and mold them a little bit? Are you able to put them in an environment that's safe and healthy?
Yes.
Because if they were with him, it would be less safe and healthy?
Yes.
Yes. What's another benefit, advantage to your son not being actively involved in your grandchildren's life?
Don't know that.
See, as long as we don't know, as long as we see more negative than positive, we're going to have negative responses to the idea of the dad not being with the son. I'm not going to go through the whole process, but I want to give you the possibilities of asking questions, understand the physical, the mental. Doesn't matter what we do, they're all three combined in that process. I could just adjust her hip, do some therapy on it, massage it, adjust the spine, or I could just adjust the spine, give her a good healing suggestion. She already got it. At least she relates the thought with the thing. This is already relaxing, and the more she starts seeing that those children are just as much of a benefit not being with dad as being with the dad. Just as much of a drawback being with dad as it is not. It's perfect. But we can't know that if our brain is telling us it's more positive, negative, more negative than positive. That's just law. That's just the law of polarity. That's the law of cause and effect. It's just knowing that. When you know how the brain works, then you know how the body's going to follow through, and that's all I'm using. I mean, it's not anything special other than knowing a little bit about the psychology and neuroscience and how to heal and suggestion. And you can do this with anybody, anywhere. But it's asking questions. And she came up with her own realization. I didn't tell her what she should do or has to do or must do. Now she can get rid of the parasite.
Good.
Just like that. We hold on to it. What's the parasite eating at her? Metaphorically.
Yes.
And there is research that shows that our genetics manifest parasites and viruses. It's in the genome. It produces proteins that create the things. It's nothing new these days. Not all viruses come from the outside. They generated from the inside. Some of them. Yes, it's the way it is. So it just gives you some ideas. When you understand how to reason, when you understand how to look at health, disease, and when we're suggesting or not suggesting, we know what's showing up in the body has to be a concept in the mind. It cannot show up in the body unless it's a concept in here. And we didn't talk about this, but even trauma. If you fall down the stairs, the thought before the fall, you weren't present. You were, and you didn't reason correctly, and that was to wake you up. Or if not, you'll wake up now to not be. You don't walk down the stairs without your glasses if you wear glasses. You will miss the bottom step. Lack of reasoning. Okay, I'm going to go ahead and adjust these 4 segments. Give you a final suggestion so you can go and get rid of this parasite. Your knee and hip will be better, and then you to process more and more on your own. I'm going to give you the benefits of the grandchildren being in the current state. Not so it's too many benefits that you're like, yes, dad needs to stay away forever. No, just enough to even out your perception. You realize that whether they're with or without, they're fine.
Well, that I know, that they're fine. I mean,
Yeah, and when this tells this, then you have resonance, you have balance. Okay, you'll get the idea. Little different type of healing, but I wanted to first start with the physical. We're going to finish with the physical. She gave me some hints. We went emotional, mental, and we could even go further than that. But receive this when I adjust these 4 segments, that's going to repair the process of digestion. Physical digestion, emotional digestion, spiritual processing, chewing on things. Turn it over. Don't pick it back up. Eliminate it and don't pick it back up. You got it? Okay. Just perfect digestive health. This goes to the intestines, the colon, all this lower part, the hip, the nerve that comes out of here goes right here. This is a gesture. I'm still suggesting. All day. I'm mentally picturing perfect digestion. I pressed on this, she got it, so that's that part. I'm going to go up to here. This one goes to like the stomach areas and the pancreas areas. We have another one here at 4. I'm a little bit low. Let's go 4. You got an extra bonus. And then a little bit of tap on the neck. These go to, look where these nerves go to. They go to all of the salivary glands, the mouth, parts of the esophagus. Very light here. You don't even have to do this. You could just touch them, massage them. You could lay your hands on them. It's whatever makes sense to her and makes sense to the person treating. It could just be hands-on. It could be a cleanse. It could be whatever it is, as long as both parties have faith and certainty in what the process is. If it's not, you know, like we said, something physical where you violate a law of the body. You need water. You haven't drank water. Me doing all this doesn't change the fact that she needs water. Maybe she gets the water of life, but she needs some physical water too. She will thirst again on this planet. Okay, so perfect. Now, Doctor, I talked about zone slips. These are suggestions, so I'm going to read to you, and I want all of you to receive these suggestions too for your digestive tract. Physically, emotionally, mentally. I adjusted the nerves that go to the liver. You'll notice an immediate improvement in appetite. That could be physical appetite. That could be spiritual appetite, emotional appetite. Food will taste better and it will be digested better.
Amen.
You still have your gallbladder?
No.
Okay. So adjusted these other nerves that go, and the pancreas still working fine?
Well,
Yes?
it's a transplant.
Okay, but it's working?
Yes.
Okay, good. So those will do their normal function. If there's any, if it were functioning too fast or too slow, they'll return to normal function.
Good.
Better digestion and better elimination. See, we eliminate through the sinuses, the lungs, the skin, the bowel, the bladder. You will eliminate that parasite. And you'll know when it's eliminated. You will have a physical, emotional, and spiritual experience when that's been eliminated, and you will know with certainty.
I receive it.
She received that.
Yes.
The glands to your stomach are being restored. And this will enable you to eat foods that in the past have upset you if you choose. Or those things that you've been chewing on in the past, you'll be able to digest and process where you couldn't before. Again, the appetite will improve, your digestive troubles will disappear. All of the glands to your intestines are being stimulated. That will enable you to assimilate the food you eat better and also assimilate the spiritual food that you're eating better. And there should be a tendency to return to your normal weight, whether that's mentally weighted down, physically weighted. Perfect digestive health. Now I'm just going to re-push on 4. 1, 2, well there's 3, that's better, and 4. What'd you notice?
4 is gone. 3 is still a little bit.
Okay, so it's still 3. Let's just stimulate those 4 segments. And by the way, since she's given me all this good food for thought, there's somebody else in here that still needs that zone 3 we didn't handle. And I'm just stimulating different parts because I want her to have this full healing. What I'm doing here, just so you can see the picture for those of you that are interested, I'm stimulating these segments, C3, T4, T9, L3. But when I'm doing this, I'm thinking perfect nerve health. I'm also visualizing, imaging the stress on the system, that stone off her system, being alleviated, and her coming to the realization that there's just as much benefit as there is drawbacks of the son not being in the children's lives. And that they're just as equally benefited by them living here as they would be with Dad. And just as much of a drawback them living with her as they would with Dad. It just is. They'll get what they need when they get there. So, we adjusted the nerves that go to your central nervous system. Your eyes become stronger, your ears keener. All your sense organs will normalize. Your spiritual eyes, your spiritual ears, your clairaudience, your clairvoyance. You'll hear things that aren't being said. You'll see things that aren't visibly seen. You'll see them with your inner faculties, your perception, your intuition, your reason, your imagination. And remember, what you image here manifest here, so you'll find yourself imaging more constructive, positive ideas. All your creative organs, even if they're not physically full in action, your creative organs, you'll notice that you're more creative. Creating on all planes. We're restoring your, again, digestion, relaxation, better appetite, better digestion, better elimination, more relaxed, not exhausted, better sleep, better nerves. So all these systems intertwine with each other. It's been exhausting having to worry about their son not being in their children's lives. But I want to ask you one more thing. Being that the son is not in your children's lives, or these grandchildren's lives, who has showed up in their lives that are representing a father or father-like figures when your son is not there?
Well, this guy that the mother was living with, which we find out that he's been abusive to my grandkids.
Okay. Similar, the current man in their life is being abusive to them. So, another point, the dad's abusive, this new man's abusive. Apparently, they need that they're attracting this somehow, or mom is, into the life. You can't avoid it. By keeping dad away, somebody else fills the role. Now, who is pouring into these children in a constructive way that is a manly-like figure that is teaching them how men and boys could act?
No one so far.
So there always has to be someone. So is it you? Are you giving them some masculine qualities, teaching them maybe how to be a gentle person? Is it the church? Is it a neighbor?
I haven't having a communication with them until recently, last month.
Okay, so you're not actively every day in their life. Okay, so what I was trying to do there is, if we perceive it's better that there is no father figure, somebody's being a father figure. Now she's getting some of it.
The mother's boyfriend.
Okay, and then whenever somebody's challenging, somebody's supporting. There can never be challenge without support. And there can never be support without challenge. It's coming from the outside in or the inside out. It's all balanced, it's all conserved across the board. But again, we'll stop this. Now we got what we came for. Perfect digestion, a balanced nerve system. And with that, you should notice that 3 is quite a bit better. 1, 2, there you go.
Yes.
Yes. Okay.
Oh, yeah.
All right. Thank you for sharing.
Thank you.
You may sit up. I try to give you a taste of a lot of different things. Do you want to share something that you received, felt, something that shifted you, and then we'll ask somebody else to share, just so we can. Anything particular that was eye-opening to you that you thought, wow, that was powerful?
Stop on thinking.
Stop on thinking. Yeah. She swallowed the biscuit and then brought it back up. Yeah. How many times we do that? We turn it over to the power and then we go, just kidding, we pull it back. Once you turn it over, it does, and then we just got to tell it what to do and visualize what we want it to do. Okay. Thank you so much.
No, thank you.
Thank you. Hey, any comments or questions from the audience before we close? Something you felt, something you heard, something you've seen? There you go.
Whenever you were healing her digestive zone, I've been dealing with digestion for a while, and the chewing on things, a lot came up for me with that, and how it's like I'm chewing it, but I'm not swallowing it. I'm not coming to terms with things, which I feel like it comes up in my body in other ways too. So that, with you walking her through that, kind of things that I knew that I needed to be reminded of, in terms of like what I'm wrestling with.
And what I've heard before is when they say it's not what you're eating, it's what's eating you. Mm-hmm. And we say, I can't stomach that. So the power says, problem with stomach. I can't process that. I got to chew on that. That makes me want to throw up. That makes my stomach sick. They're just commands that if they can go in. Right? Anyone else?
As you were sharing about, and you were asking her questions about what are the benefits of their dad not being in their life, that's something that I've struggled with as well, because I have 3 kids that are young adults that their dad is not in their life either. And so as you were asking those questions, like I was answering them, because I've always thought that there was a lot more negatives to their father not being in their life also. But then I started to think, just the other day, we went out to eat, and my youngest son, who's about to turn 21, has decided to go to college, which that's been, I mean, we've been on a 5-year journey. And my older daughter went to school for art, which are all things that I know the benefits is if their father was in their life, they would not be doing, because he was a very controlling person. They would not be able to go for the things that they wanted to, or go when they wanted to, or how much time they wanted to, because it took her several years to go to college. But he was very like strict, and I don't think that they would have fully been able to do things kind of in their own way, the way they wanted to, had he been in their lives right now. So yeah, that really came up to me. So I can see now the benefit in them right now being able to be the people that they're growing into, because they have kind of that latitude to be able to make their own choices, the way kind of God's directing them.
Good. So the questions you ask change your perception. The perception changes your decisions, which change your actions. And most disease is when your perception determines the chemistry. So if you have a stress perception, you get stress chemistry. You get things like adrenaline, cortisol, epinephrine. If you're on the support side, it releases parasympathetic chemicals like oxytocin and serotonin, and things that relax the body. Too much or too little of any of those creates disease. It throws us off center. So our emotions, our perceptions change the ratios of chemistry in the body, then the body tightens up or slows down or speeds up digestion, or speeds up glandular function or slows down glandular function. These questions come from understanding the universal laws. If you understand the law of polarity, if you understand the law of rhythm, you understand these certain laws of cause and effect, the laws of gender, you start to understand that, wait a minute, there can't be a one-sided magnet. You can't just have a positive, you cut the magnet in half, it still has two sides. Well, how am I trying to make life one-sided, always good or always bad? And it creates a change in your chemistry, which throws the zones off in the body, which makes problems for all the doctors to try to figure out. It makes you susceptible to stuff to get in the body or on the body. And all of you can use this, whether you're a healer, because you're also a self-healer, if you understood how to reason and understand how the body works and how our thoughts create things. Okay. Any other last comments? Good. I know it's well past. I blame you. I had it timed out perfect. I didn't have your questions timed. I didn't know. Any last minute? Anything else? Okay.
I do have a question.
One question right here.
Mike's up here.
Oh.
So I'm a nutritionist, and I also use muscle testing. So how do I apply this when I'm scanning the body? I already have like a lab test telling me some things about this client when it comes to nutrition, because
Right.
I know they're eating things that are not good for their
Yes.
body at that time.
Are they not hearing, babe? Or is the mic, is it green? Can you all hear me? Okay. Oh, mine is red. Mine's not working. Mine might be out of battery.
I need to talk to Mom.
Battery, but, okay. Well, I don't know what's wrong with this. So her question,
Wait a second. Run that back to your dad.
that on the charger. What else wrong? So her question was, how as a nutritionist does she apply this type of work? Well, the good thing is remember suggestion. It's the principles applied. What image do you have for your client in mind? And how can you get that suggestion over to their mind? First, you got to establish the faith. How are you going to do that? Are you using some pictures? Are you using gestures? Are you using your writing? Are you subconsciously vibrating this to them? Are they fascinated by what you have to say? Are you using some form to get them to have faith in you? And then you start also working on the suggestion to get it to them. And then you give them suggestions. Like you'll notice that you starting to have a tendency to drink more water instead of Coke. You'll find that when you look over there at that, you'll have a less of a taste for it because your body's cleaning out. Your body's not going to desire the nasty stuff. And if you go ahead and when you are hungry, I find if you walk before you go to the cabinet, you'll also get rid of the urge so that you're controlling the body and the body's not. So you're using principles. So once you learn the principles, you'll formulate it to your technique. You won't be doing this probably. You'll have your own and we'll assist you in that. But it's about the principles. Do you understand this composite personality? Do you understand suggestion? Do you understand fascination and agreement? Do you also understand the laws involved and how that works? And being able to resonate with the person on what their love language is in a way that you can communicate with them. Doc, I don't want to be pushed on. If I push on them, we're going to not have they're going to lose faith. If I'm not listening, what is it that they want? I make an assumption. I'm not carrying the image of what this healing is going to do and show them what's going to happen. And then sometimes you've got to change that behavior and habit. If they're not changing, it's that we need a new way to communicate. Show them a picture.